Ok. Muy buenas noches para todos. Vamos a dar 3 minuticos más para que las personas terminen de conectarse a nuestro Zoom y arrancamos. Doctor Muñoz, por aquí lo están saludando.
¿Quién?
César Álvarez, que muchos
Oh,
saludos.
César, un abrazo grande. Qué rico saber de ti.
Buenos días para todos.
Rodrigo,
Buenas
¿qué hay?
noches.
¿Cómo
¿Cómo
está,
está,
Rodrigo?
doctor Muñoz?
Bien, ¿cómo vas?
Bien, bien. ¿Usted qué tal? Qué
Bien,
gusto verlo.
bien, señor presidente. Qué rico verte también.
Muchas gracias.
Bueno, doctor Vargas, son las 7:33. Creo que podemos ir comenzando con nuestro webinar. El doctor Rodrigo Vargas, presidente de la Sociedad Colombiana de Ortopedia, va a dar un saludo para todos. Adelante, doctor Vargas.
Buenas noches para todos. Para mí es un honor presentar este webinar que es organizado por la Sociedad Colombiana de Ortopedia Infantil, en cabeza de su presidenta, la doctora Sonia Quevedo, y con la participación como invitado internacional del doctor Stuart Weinstein y los panelistas colombianos, los doctores Edgar Muñoz, Rodrigo López y Celso Pedraza. Creo que el tema es un tema de habilidades blandas, de cómo nosotros enfrentamos nuestros pacientes, cómo hacerlo de la mejor calidad posible, y pues tenemos tres referentes nacionales sobre el tema y un invitado internacional de alta calidad. Muchas gracias, doctor Weinstein, por su participación. Sonia, muchas gracias. Adelante. Apagada, doctora.
Ahora sí me escuchan, ¿verdad?
Correcto.
Sí,
Muy
correcto.
buenas noches para todos. Muchas gracias por acompañarnos, especialmente a nuestros panelistas. Gracias a la Sociedad Colombiana de Ortopedia por presentarnos, ayudarnos siempre y apoyarnos desde el punto de vista de la organización y la logística de estos webinars. Hoy tenemos un panel de lujo. En primera instancia, quiero saludar a nuestro invitado internacional, el doctor Weinstein, profesor de ortopedia infantil de la Universidad de Iowa, cirujano ortopedista infantil, cirujano de columna, con una trayectoria increíble desde el punto de vista de la ortopedia, pero también con una experiencia importante en temas médicos como el que nos ocupa hoy. Fue un gusto escucharlo tanto en los temas de liderazgo como en los temas de cadera y columna en el Congreso, y pues quisimos que nos presentara hoy esta conferencia sobre la excelencia. Voy a presentar ahora a nuestros panelistas nacionales, que muy conocidos por todos nosotros: el doctor Edgar Muñoz, presidente de la Sociedad Colombiana de Ortopedia entre el año 97 y el año 98, profesor de la Universidad del Rosario y posteriormente de la Fundación Universitaria de Ciencias de la Salud, donde actualmente es vicerrector, con una trayectoria impecable y profesor de muchos y gran amigo de todas las personas que lo conocemos. El doctor Celso Pedraza, presidente de la Sociedad Colombiana de Ortopedia entre el año 2003 y el año 2004, profesor de muchas generaciones de médicos y de ortopedistas de la Universidad Industrial de Santander, organizador de gran cantidad de cursos también en la Regional de Santander y con una práctica privada impecable durante sus años de experiencia profesional. Y el doctor Rodrigo López, también importante amigo y muy querido, trabaja desde hace muchos años en Colsanitas, fue profesor en el 2007, entre el 2007 y el 2009 de la Sociedad Colombiana de Ortopedia. Y recibió una importante distinción de parte del Comité Olímpico Colombiano por su aporte al deporte colombiano. Los tres doctores han tenido un interés especial por estos temas de liderazgo y por eso creemos que su participación en este webinar es muy importante. Entonces, doctor Weinstein, adelante, lo escuchamos.
Well, thank you very much. I want to, first of all, thank all of you for your kindness and hospitality at the annual meeting in Cartagena. I had a marvelous time. I learned a lot, and I appreciate being able to come back and give one more lecture. So this lecture is based on about 8 months of thought, and I was asked to write this by one of my former residents, who is a major journal editor. He contacted me last year and asked me to put my thoughts on paper about sustaining excellence over a career. Now, I still practice full time. I operate 2 days a week. I see patients 2 days a week, and I do research. And I took 37 years of trauma call at a level 1 center. So when I say these comments, particularly the younger surgeons, I walk the walk. I do what you do every single day of the week. And I hope the comments that I make today will be of help to you in your career. It won't be too long, but and I thank the other distinguished past presidents of the Colombian Orthopedic Association for joining in on the discussion. So I hope that what I have to say to you will have some value. So excellence can be defined as a quality of excelling, possessing good qualities to a high degree, and it can also be defined as exceeding expectations. I have had the good fortune to be enjoying an almost 50-year academic career as a pediatric orthopedic and spinal deformity surgeon, researcher, teacher, orthopedic leader. And in each of these roles, I've always been motivated and sustained by a multitude of interrelated factors. I haven't read any books, but there are many books you can read about this subject, about how you're sustaining excellence. And maybe they would be more helpful than the comments I'll make today and maybe be stated in a more articulate fashion. But the motivating factors that I'll speak about were developed and driven by mentors and personal perspective and experiences during my career in pediatric orthopedics. The primary driver in my pursuit of excellence is my own expectations. This is a famous football coach in America. He was very famous in the 1960s. And he wrote that perfection is not attainable, but if we chase perfection, we can catch excellence. Excellence is a relative condition achieved by going above and beyond expectations set by institutions, others, or yourself. Meeting and then exceeding my own very high expectations, keeping that bar moving up and up and up. The fundamental motivating force for me has always been exceeding my own very high expectations, whether that's in surgery, giving a lecture, running a board meeting, my morning run, or my weekend bike rides. This requires Even after a successful experience, we can almost always come away with opportunities for improvement. Some of you might find this exhausting, but for me, it's always been exhilarating. A second motivating factor for me is exceeding the expectations of others. I've worked in an academic department in a major university my entire life, and I've always wanted to meet and exceed the expectations and metrics set by the department and my institution. In that context, one way to frame excellence is to constantly put the needs and expectations of our patients first. We should try to put ourselves in their shoes and ask, if this were my son or my daughter, how would I want them cared for? What treatment options would I consider, or more importantly, not consider, if a loved one was in this situation? What do our patients and their families deserve from us and our teams in the clinic, in the operating room, and on rounds? I try to put myself in the position of the patient or the audience in a lecture or my fellow board and committee members and anticipate what they want, what they need, and what they expect from me. As teachers, we should try to envision the learner's perspective to provide them not only with the information we think they need, but the information we know they need to be good practitioners. As an example, I give the same 10 or 12 lectures every 2 months to the residents and students on the pediatric orthopedic service. Yet I redo every lecture after every rotation. I'm always looking for ways to improve their experience. I modify, take out, or add in new material or case examples as they become available. I always make sure to cover the topic in an unbiased fashion, but also to give the topic my perspective and the evidence to support that perspective. As my career became more focused on pediatric hip and spine deformity, and the range of surgeries likewise narrowed, I always stayed focused on the moment and the individual patient and how their anatomy, their pathology, or other circumstances made them unique. The responsibility of being entrusted by parents with their child requires that we bring our A game to work every day. Preparation helps us avoid overconfidence and ensures that we meet expectations while avoiding complications and not making the morbidity and mortality conference list. While all of us can and should take pride and get enjoyment out of our successes, self-satisfaction leads to complacency. And when I become complacent, it'll be time to think about doing something else. Another factor in sustaining excellence is humility. And here we need to address managing complications. Surgeons are not generally known for humility, but it's exactly what we need. Humility is needed to develop collegial, nurturing relationships that directly or indirectly improve patient care. I try to remember that despite my age and experience, I don't know everything, and I'm frequently not the smartest person in the room. I especially try to remember that sometimes the smartest person in the room is my patient or their caregivers. Along with a certain degree of humility is understanding that nothing we do in our careers should be motivated by self-promotion. It's incumbent for all of us to remember that the goal of our careers in all of its dimension is to serve our patients, their families, and the organizations that make our lives better, and to guide our actions by those goals. Hopefully, young surgeons start their careers with some degree of humility, as would be commensurate with their clinical experience. Over time, however, contributing to humility is one's life experiences, particularly those which involve dealing with adversity, disappointment, and unmet expectations. These challenges to personal development come in many forms and gradation, from patient complications to not getting an organizational leadership role or committee position, to having your research work rejected from publication, and so on. When you fall short of your motivational goal to make things better for patients or organizations, How you cope with these expectation failures can have a profound effect on your personal quest for excellence, and in some cases, your own self-worth. Despite bringing your A game to work every day, patient complications occur in everyone's practice. The magnitude of the complications varies, and the ability to deal with them on a personal level may prove a most difficult challenge. Having a patient die in the operating room, causing a neurologic deficit during spinal deformity surgery, or having any unexpected intraoperative complication not only causes a life-altering event for the patient and their family, but also for the surgeon, the so-called second victim. How you cope with these adverse events is an aspect of a career, albeit unpleasant and often unbelievably stressful, that must be addressed in trying to sustain excellence. When patient adverse events happen, surgeons naturally feel personally responsible that they've failed the patient. Depending on the seriousness of the adverse event, many surgeons begin to second-guess their clinical skills and knowledge base. Many report difficulty concentrating, declining clinical judgment, loss of confidence, trouble sleeping, and difficulty enjoying life. Other reactions include frustration, embarrassment, anger, blame, worry about your reputation, and reduced job satisfaction. Depending on the seriousness of the patient complication and one's ability to cope with the event, and the results for the surgeon vary from getting by and moving on to dropping out, stopping surgery, or even stopping practice. There are no brilliant solutions to coping with these events, but what's most important is to have institutional and personal support mechanisms, colleagues, mentors, friends, to help you deal with these most difficult situations. Knowing that you did all you could to acknowledge and inform potential risk, mitigate that risk, and emphatically manage sequelae can help. Avoidance strategy for me to avoid complications is always finding time to have a pre-surgical, open and transparent dialogue with the patient and family, going to the operating room totally prepared for the case at hand, going over each step of the surgery in my mind well before the actual surgery, having confidence in my preparation and my abilities, maintaining total focus and avoiding distractions during surgery are the keys to meeting your and the patient and family expectations. Disappointment and not meeting personal expectations are more common issues that one must address. Not getting a committee assignment, an organizational leadership role, a desired position, or having a paper or manuscript rejected are real-life challenges to many motivated individuals. One needs to keep these types of failures of not meeting expectations in proper perspective. Keeping yourself focused on what's important is critical to sustaining excellence. These types of failures to meet personal expectations are less important in the scope of a career. They should never diminish your self-worth. Each of us in our own way are having a positive impact, keeping in mind that you are making a difference in the world each and every day you go to work. After a disappointment, it's important to take a step back and realize all the good you're doing as a doctor and as a surgeon. You are making a difference in your patients and their families' lives. Keep this motivational aspect in mind, that the goal of each of our careers in all of its dimensions is to serve our patients. That's why you became a doctor, and that's why you became a surgeon. Now, the need for evidence is another motivational factor sustaining evidence. The foundation of my orthopedic career was heavily influenced by these mentors who you see in this slide, many of whom you wouldn't know, but who valued evidence-based medicine even before it was a popular term. And these gentlemen were not motivated by financial pressures. All of them were on salary, so they didn't make more money if they did more surgery. Their professional careers were about patients, families, organizations, and how do we make them better. Striving for excellence in patient care or in organizational work warrants establishing internal and external metrics which expand the evidence base. We don't want to be doing an activity just to do the activity. We want to achieve metrics that have meaning. So in patient care, it's about tangible metrics, improving outcomes, improving function, alleviating pain, higher levels of decision-making, and more efficient surgery. In the organizational world of a board or committee meetings, expectations start by being respectful of everyone's time and opinions, not meeting just to meet, or having time wasted by lack of preparation, going over information that could be read independently, or by not focusing discussion time on important issues and valuing everyone's input. In organizations, it's about moving the organization forward. It's humbling to realize how much of what we do is based on low levels of evidence and a lot of so-called expert opinion. There's immense variation in all of our practices, with often little evidence for the effectiveness of different approaches. Requiring evidence pushes me to keep my knowledge base current, to put perspective in the levels of evidence I use in decision-making, in evaluating the literature I read, the lectures I attend, and so on. Having done so many long-term follow-up studies of treated and untreated conditions in pediatric spine and hip conditions, and having actually seen and examined these patients, helps to keep this perspective always front and center in my personal thinking. In a surgical field, constant follow-up of your own patient also keeps this point of view in proper perspective. As one of my learned colleagues said, nothing destroys confidence like follow-up. The constant quest for evidence mandates that I continuously review my surgical results and compare them to available benchmarks. Most of what we do in medicine is neither black nor white, but varying shades of gray. This leads to another motivational factor, especially if one does basic science or clinical research: the quest to try and answer clinical and research questions that bring better treatments or more appropriate treatment options to patients. Now, even if you don't personally do research, I feel strongly that all of us need to support research by supporting colleagues who do it and funding organizations that support research. In the United States, we have the Orthopedic Research and Education Foundation. I don't know what you have in Colombia, but I'm sure you have a similar organization. And even if you don't do research, you need to support your colleagues who do research by donating to that organization. Medicine constantly evolves, and even those of us at the top of our game must stay current and relevant. I'm constantly reading the orthopedic and health policy literature, understanding and developing skills for new procedures, even if I don't personally think they're ready for widespread use. Throughout my career, I've always budgeted time to visit and spend time with individuals I considered thought leaders, seeing patients in clinic with them to learn their thought processes, or watching them do newer surgical techniques while deciding if I could, or more importantly, should incorporate these procedures into my practice. As an example, having started my spinal surgery career during the Harrington rod era, I had to learn all of the subsequent techniques and approaches on my own: open anterior spinal surgery, instrumentation, Dwyer, Zilke, CD instrumentation, other posterior systems, pedicle screw techniques, vertebral column resections, spinal tumor resections, trauma care, PSOs, vertebral body tethering, etc. I had to learn all of these on my own. In my early years, I spent a month with John Hall at Boston Children's to learn his approach to spinal deformity treatment. I also spent time with Bob Winter, John Lonstein, and David Bradford at the Twin Cities Scoliosis Center to gain their perspective on the various spine deformity approaches. And after studying CD instrumentation in the 1980s, I invited Jean Dubuisset, who recently passed away, and Harry Schuffelbarger to come to Iowa, visit, and critically review my cases. Over the years, the same approach to updating educational and surgical education continues. In pediatric hip disorders, I spent a month with Bob Salter learning his approach to hip dysplasia. with Wood Lovell at the Atlanta Scottish Rite Hospital on his general approach to various hip conditions. When I felt the Pemberton osteotomy might offer my patients more options than the Salter and Amidate osteotomy, I spent a week with Sherman Coleman in Salt Lake City learning to do a proper Pemberton osteotomy from the master. And after learning PAOs in the early 2000s, I practiced on cadavers during the evening hours until I felt comfortable operating on patients. I never felt the need to be at the cutting edge, but always wanted to offer my patients options that had been well thought out and researched. I was always comfortable in the approach that I might be one fad behind. I have never been willing to experiment on patients. I would only offer new treatments if they were well reasoned and if the patient and their family were informed participants in a clinical trial. Staying current also helps us provide up-to-date information to help our patients and their families negotiate the often treacherous waters of internet misinformation and physician self-promoting advertising and direct-to-consumer marketing. Excellence in patient care mandates use of shared decision-making and evidence-based practice. We need to know the levels of evidence supporting what we're suggesting. We need to understand our patient and family expectations and bring to bear our personal experiences, which increase each and every year to help our patients and families make important healthcare decisions. These concepts are so critical to demonstrate to residents and fellows who hopefully will carry the same approach forward to the families and children not yet born. Saying no to yourself and others. We need to develop an understanding of our own personal bandwidth for tasks and responsibilities. No activity is worth doing unless it's worth doing well, from surgery to a research study to leading a professional organization. We have to have an unbiased and accurate assessment of the capacity to do each activity, developing self-awareness to take on only what we have the capacity to do at the highest level. Effort matters, and if we're not prepared to give an initiative task force our full attention, perhaps we should reconsider taking it on. Participating in the larger orthopedic community was always important to me. It was an expected part of the academic culture in which I was raised. In all of these organizations, which I've had the great privilege of leading, I was passionate about their mission and vision, and hence it made it easy for me to use my non-practice time and give 100% effort to these organizations. Participating at any level in an organization whose mission we invest in can be very satisfying use of our non-practice time. Carrying out assigned responsibilities at the highest level can provide a sense of contribution to the larger orthopedic community. I'm a believer that hard work and excellence in performance is rewarded by other organizational opportunities if you want them. However, participating in the greater orthopedic community, motivated by personal gain, is a disservice to the larger community and a really poor use of your non-practice time. I cannot underestimate the importance of maintaining personal wellness. I've always operated under the rule that I have to take care of myself first before I can take care of others. I've always exercised before the workday begins, regardless of where I am in the world. For me, this would be daily jogging and weekend road cycling. Once I've taken care of myself, I can devote the rest of the day to taking care of my patients, my research, and my other activities. This has been a constant my entire professional life. Maintaining excellence is not easy. It takes constant nurturing. Maintaining excellence is made somewhat easier when you love what you do and when you view each day as an opportunity to do something positive. When your job is not work, it becomes your passion. And as Charles Dickens wrote, my meaning simply is that whatever I have tried to do in my life, I've tried to do with all my heart to do well. That whatever I've devoted myself to completely, that in great aims and in small, I've always been thoroughly in earnest. Ladies and gentlemen, I hope that these words of maybe wisdom about how sustaining excellence over a career will resonate with some of you, and I certainly look forward to the leaders of the Colombian Orthopedic Association and their comments about sustaining excellence in their own personal lives. Thank you very much.
Dr. Weinstein, thank you for your talk. All these tips that you have given to us are very important. I think in any moment of our professional careers. Doctor Weinstein, muchas gracias. Todo lo que usted nos ha dicho es importante para quienes están empezando su carrera profesional, para quienes estamos tal vez en la mitad, y creo que las personas que llevan más tiempo que nosotros ejerciendo su carrera y han tenido posiciones importantes en diferentes em, eh, eh, cosas académicas en la Sociedad de Ortopedia tendrán comentarios también muy importantes que enriquecerán esta discusión. Entonces quisiera comenzar por el doctor Edgar Muñoz y escuchar de su parte sus comentarios. Doctor Muñoz, adelante.
Okay, Sonia. Dr. Weinstein, thank you very much for your excellent paper.
Thank you.
I think that this paper define that doctors must be. A raíz de esta invitación generosa que nos has hecho, Sonia, uno tiene oportunidades de pensar sobre lo que ha sido la vida de uno, qué se ha hecho, etcétera. Entonces, comencé por definir o por pensar qué era la excelencia. La excelencia, pues, la defino como una cualidad de ser excepcional o superior en comparación con otros en un determinado ámbito. Implica la realización constante de esfuerzos para alcanzar y mantener altos estándares de calidad dentro del marco de la ética, por supuesto. La búsqueda de la excelencia no solo se trata de conseguir resultados sobresalientes, sino también de mejorar continuamente el aprender de los errores y actuar con integridad y responsabilidad. Personalmente, implica la convicción de querer ser mejor cada día, basado en el desarrollo del conocimiento adquirido permanentemente y por la experiencia generada a través del trabajo diario, a través del tiempo, en donde no solo las cosas buenas nos estimulan, sino que también los errores nos pellizcan y hacen que queramos ser mejores cada día. En este contexto es imperativo el concepto de la compasión, pero la compasión no entendida como lástima, sino la compasión entendida como el ponerse en los zapatos de los pacientes, en lo que le gustaría a uno que lo trataran como es paciente, que desgraciadamente es un tema que hoy se ha perdido y que es lastimoso que esto ocurra. No tengo duda que la compasión es tan importante o más importante que la misma formación académica y el esfuerzo por el trabajo diario. El ser compasivo, el entender los pacientes, en mi ejercicio, en lo que fue mi ejercicio profesional, pienso que fue fundamental y fue un aspecto trascendente en mi vida. El humanismo en medicina es un imperativo ético y se refiere a un enfoque que prioriza al ser humano en procesos de atención médica, enfatizando la dignidad, los valores y las necesidades de los pacientes. Este concepto reconoce que los pacientes no son solamente casos clínicos, no es el paciente con el menisco o con el cruzado anterior roto, sino son individuos con experiencias, con emociones y además en contextos sociales que influyen en su salud y en su bienestar. Es fundamental mantener la humildad y no hipertrofiarse, cosa que ocurre muchas veces cuando uno se siente arrollado por el éxito. Hay que mantener ser humildes, mantener una condición pero mantener una condición de liderazgo, no solamente como médico, sino como persona, como docente y como formador de colegas. ¿Cómo mantener la excelencia? Me puse a pensar. también. Entonces, lo más importante para mí es la motivación y el amor con cada acto que uno hace como médico. Eh, eh, Ser médico sin compasión, pues no tiene sentido. Es volverse una máquina que hace cosas, pero que no, cuando no se entiende la condición humana en toda su dimensión, eso no, por ahí no es. Aprender de los errores porque no somos perfectos. Todos cometemos errores y esos errores deben ser motivos de reflexión que permiten obviamente superarnos cada día. Indudablemente, por supuesto, la actualización debe ser permanente. Es una condición sine qua non. Hay que asistir a congresos, hay que leer revistas, hay que producir artículos, hay que investigar. Otra cuestión importante es el compromiso institucional. Eh, Querer su hospital, querer su institución como si fuera de uno, que realmente es de uno, porque ahí donde uno creció, donde uno nació, donde uno se hizo, donde uno se formó, y es fundamental ese compromiso institucional. Eh, Compartir los conocimientos y habilidades es muy importante y pedir ayuda. Uno no es infalible. Si uno tiene un caso complejo, difícil, yo llamo a mi compañero, lo llamo a Rodrigo. Rodrigo, venga, me ayuda a operar este caso porque no sé cómo solucionarlo. Dos cabezas piensan más que una. Y eso no demerita de ninguna manera la actividad médica de la persona. Otro aspecto importantísimo es planear lo que uno hace. Sentarse el día anterior de una cirugía, por ejemplo, y frente a un negatoscopio, meterse en la cirugía, qué es lo que le voy a hacer, y pensar qué posibilidades de error pueda tener. Esa es una manera muy importante de evitar problemas. Em, Fundamental participación activa en eventos científicos, publicaciones, ser líder, eso genera liderazgo en la comunidad en que uno está. Desarrollar actividades docentes, de las cosas o de las actividades más enriquecedoras de la vida médica es la actividad docente. Es ver uno cómo los que fueron chiquitos crecieron y lo superaron a uno con creces. Eso es muy importante. Em, y finalmente, un aspecto que me parece trascendente en la vida de las personas es el equilibrio emocional. Y equilibrio emocional me refiero a, a que uno desempeñe su vida dentro de un ambiente amable, enriquecedor, que tenga uno sus hijos y que uno luche por ellos. Eso es ponerle orden a la vida. Eso es trascendente para lograr el éxito. Eso quería comentar, doctora Sonia.
Muchas gracias, doctor Muñoz. Excelente complemento. Eh, Doctor Pedraza, quisiéramos escucharlo también.
Aló,
Lo escuchamos, pero no lo vemos. Pero ahora sí lo vemos, doctor Pedraza. Gracias.
gracias, Sonia, doctora. Eh, bueno, escuchando al doctor Beisen y al doctor Muñoz, evidentemente buscar la excelencia es como una recta curva, como un oxímoron. Es perseguir lo que uno desea con, con la mejor voluntad. Ah, tuve la fortuna de vincularme al terminar la residencia al Departamento de Anatomía de la Universidad Industrial de Santander como docente, y lo que dice el doctor Muñoz, esto lo lleva a uno a estar siempre queriendo ser mejor y autoevaluarse permanentemente porque los alumnos lo están evaluando. En este contexto, en la maestría de docencia universitaria, escribí un documento sobre la transición de novato a experto, cómo podemos desde la docencia convertir un residente y llevarlo desde espectador a que sea actor, y como dice el doctor Muñoz, de pronto en el futuro nos sobrepasan en destrezas y cualidades, es decir, debemos difuminar nuestra autoridad sin llegar, sin llegar al límite de la competencia o al borde de la incompetencia. Este trabajo implica un complejo proceso de cambio conceptual y emocional para llevar las diferencias del novato a que se convierta en un experto, igual o mejor que el profesor. Igual trabajé en la universidad en programas de desarrollo profesional continuo y desarrollé una serie de actividades académicas en las cuales me acompañaron los mejores líderes de opinión en su momento, como el doctor Muñoz y el doctor Rodrigo López, en un curso de ortopedia al día en Santander. Posteriormente, buscando la excelencia, organicé un curso en convenio con la Sociedad Colombiana de Ortopedia y la Universidad Industrial de Santander de artroscopia de 9 días. Pude conseguir 40 rodillas para trabajo con el concepto de aprenda haciendo, no mirando. Y eso me ha dado muchísima satisfacción, y siempre, como dice todo el contexto hablando de excelencia, no estamos exentos de complicaciones, las cuales debemos pues asumir con responsabilidad y aprender permanentemente qué hice mal, cómo puedo mejorar y cómo puedo evitar, planeando previamente lo mejor posible cada procedimiento. Como decía uno de mis mentores, un gran profesor mío, el doctor Guillermo Alonso, profesor de anatomía, y cada procedimiento era una demostración de un verdadero arte de anatomía quirúrgica. El que diseca opera 2 veces. Con ese concepto hice mi profesión a través de la vida, y de la misma manera enseñé a todos mis alumnos y residentes. Esto quería comentar con respecto a la búsqueda de la excelencia.
Muchas gracias, doctor Pedraza, por compartirnos su experiencia, doctor López. Usted tal vez es el más joven del panel, pero con una experiencia
Es el
No,
muy
chiquito del
grande.
panel.
El
no diga
chiquito.
eso, el menos viejo. Uh, Once again, good evening, and I want to thank Dr. Weinstein for such an inspiring talk. But instead of adding, I have nothing to add what has already been said. I would like to make a couple of questions. First of all, Dr. Weinstein, when you lead, what is the advice? Prep talks, or leading by example of something between?
Yeah, leadership style is very different for different people. So I'd say in my daily life, I try and lead by example. So for the residents, I want to be the doctor. I want to take care of patients like I would want to be taken care of, like I would want my wife to be taken care of, my son to be taken care of. And I try and set that example on a daily basis in my practice. And same with surgery for the residents, since I work in an academic institution. They know my preparation for every case. They know, I finished surgery about 10 minutes before this lecture, but I'm always critical. What could I have done better today? And telling them, this is what I think I could have done better. What do you think? So that's in daily life. But when you're leading an organization, then it's also by setting an example. But I think as a leader, one thing I always learned was that 80% of my time I should be listening and I should only be talking 20% of the time. That's one. Number two is I need to respect everyone who's at the table and make sure that each person has their chance to express an opinion, but you also have to prevent people from monopolizing the conversation. You need to go in an orderly fashion, stay on message. And I also, in leading, I don't like to waste people's time. I hate going to meetings where I could have read all of this. I didn't need to have someone read it to me. I want to discuss issues. I want to have us all talk about the things that are important. So in leading organizations, a bit different. It's a leadership style, but it's a style that it's not important to be popular, but it's important to be respectful and appreciate that everyone has value at the table. Even if you don't agree with them, they have value and everyone has a chance to influence the conversation. So that's a long-winded answer to your question.
100% agree. Thank you very much. Second question, and this is, I want to apologize beforehand because it's kind of sarcastic. What do you do in the search of excellence when the system around you seems to reward mediocrity instead of,
Yeah, I understand the question perfectly. So that's where I think you want to, there's a saying that we say, maybe you have a saying in Spanish, if you're not at the table, you're on the menu. So I think it's important to play a leadership role in your life, whether it's at your hospital, your department, your practice, because everyone complains in the locker room how bad things are, but you need to try and change those things. And you have to be a leader and try and convince people. But I understand because I work in a large system, which sometimes rewards mediocrity. And it's quite frustrating. But again, there you have to set the example. For example, for surgery, I'm the first one in the room. The anesthesiologist knows that I will be there minute one. I don't leave until the wound is closed. And I expect the same from them. So my cases always start on time. My turnovers are always good, even though my institution, you could find fault with, lots of things. But I try and set the standard for my little world.
Yes, that's right. No, I just want to thank you once again, and maybe if somebody else want to make questions, I don't want to monopolize the talk. Thank you very much and good night.
Thank you.
Tenemos algunas preguntas de los asistentes. Quiero invitar al doctor Marco Maecha, secretario de Socodina, que nos acompañe con las preguntas. Doctor Maecha, por favor, prenda su cámara y su audio. Gracias.
Hola, profesor. Buenas noches. ¿Cómo están? Un abrazo para todos, especialmente al doctor Weinstein, bueno, y a todos nuestros panelistas, que es un lujo tenerlos en esta jornada. Sí, el doctor Rodrigo Vargas pregunta, yo supongo que para todos los panelistas, ¿cómo influyó la investigación en su práctica?
Sí, yo creo que los procesos de investigación son muy importantes porque es una manera de progresar, es una manera de echar pelante. En mi caso personal, por ejemplo, eh, hablando de la rodilla con los temas del ligamento cruzado anterior, siempre los trabajos de investigación que se hicieron nos permitieron mejorar y en la medida que esas investigaciones dieron resultados, nos permitieron hacer que nuestros pacientes fueran mejor, evolucionaran de la mejor manera posible.
Yo quisiera agregar un comentario, siempre hablando del sistema. Si el sistema no es consciente de que hay que invertir en investigación, primero solamente desde el punto de vista puramente educativo, y segundo, cuando usted investiga, desarrolla, y cuando desarrolla tiene un producto, y cuando tiene producto lo puede vender. Luego, en últimas, la investigación termina trayendo de regreso lo que se le ha invertido y a veces con creces. Esa es la importancia de la investigación.
Genial. I don't know if Dr. Weinstein want to tell us about that question.
About the importance of research or the,
Yeah, how did the research or your
well, for
research
me, yeah,
impact your daily practice?
yeah, for me, research has always been part of my life because it was part of my training. All of the doctors who I trained with all did research, some basic science, but most did clinical research. And so it was just part of my culture. And also, I think all of us are curious. And when I go to a conference, I have a legal pad and I write down all of the questions I don't understand. And especially when you have so-called thought leaders, the experts giving you opinions. And if I don't agree with that opinion, I want to write it down because I want to investigate further. So I think all of us are curious. Not everybody has the ability to do research. Not everyone has the funding to be able to do research. But I do think in your practice, number one, you should support research. And again, I don't know if the Colombian Society has a research foundation, but I think if you don't do research, you should contribute money so other people can. Number two is whatever your practice is, if it's arthroscopy or arthroplasty, you can capture data of your patients and contribute to a national registry or a study group. So you can look at your cases and say, how am I doing as a practitioner? That's not necessarily research that would be published, but it gives you feedback to say, I am a good practitioner. My complication rates are good. My hip redislocations are low. My infection rate is low. So I think everyone can collect data and participate in a study group, or I don't know if you have registries, but those are simple things where you're actually doing research, but you're also doing quality control to make sure that your practice is, a high level. So for me, it's my life. I every day I do some research, but I realize it's not for everyone. And not every research project changes the world, but I think every research project you learn something from, which you can then apply to practice.
Thank you, doctor. El doctor César Álvarez nos pregunta qué opinan de las implicaciones y repercusiones del uso de herramientas como la inteligencia artificial y cómo se pueden usar para lograr esa excelencia.
Yo pienso que la inteligencia artificial es una realidad que se nos vino encima, que va a seguir progresando de una manera infinita y que va a cambiar muchos temas en la historia de la humanidad. Sin embargo, pienso que, vuelvo y repito, o hago relación de lo que hablé, las máquinas, la inteligencia artificial puede evaluar síntomas, signos, resultados de laboratorio, imágenes, pero jamás podrá evaluar los temas de compasión con el paciente. La computadora jamás podrá meterse dentro del alma de un paciente y entender su sufrimiento, sus angustias y los problemas que tiene. Pero indudablemente la inteligencia artificial o es ya una cuestión que va a cambiar radicalmente muchos aspectos en la humanidad. Para bien de los pacientes en medicina, por supuesto, ¿cierto?
Gracias, doctor Muñoz. ¿Alguien más tiene algún comentario al respecto? Bueno, había una pregunta que me parece muy importante y es sobre el balance de la vida familiar y la vida profesional. Hace unos días vino una primita que acaba de terminar su colegio y entonces me decía que varios médicos con los que había hablado le habían dicho que no estudiara medicina, porque los médicos no teníamos familia, porque los médicos teníamos vidas fracasadas, porque los médicos vivíamos amargados, solos. Por supuesto, sé que no es la vida de ninguno de los que estamos aquí y tampoco de la mayoría de personas que están en esta webinar, pero así nos ve la sociedad a veces. Entonces, ¿cómo lograr el balance entre una vida profesional exitosa y una vida familiar que sepamos cuidar, que le demos la importancia a nuestro cónyuge, a nuestros hijos, a futuro a nuestros nietos? ¿Cómo lograr ese balance que me parece tan importante? Para mí lo más importante en mi vida es poder mostrar una familia bonita. Eso es lo más importante para mí. El resto es importante, pero son añadiduras. Quiero saber cómo lo han logrado ustedes.
Sí, Sonia, es un tema em, que aparentemente es complicado y es difícil. Y como dije al final de mi charlita, el equilibrio emocional es fundamental para tener el éxito profesional que uno quiere. Y ese equilibrio eh, se logra solamente cuando uno le dedica todo el tiempo necesario a su familia, eh, porque por encima de cualquier tema, lo primero es la familia, son los hijos, es la señora, y hay que hacer sacrificios, indudablemente que hay que hacer sacrificios. ¿Cuántas veces salimos de la casa a las 6 de la mañana y regresamos a las 9 de la noche cansados y de pronto uno no quiere saber nada de nada, pero ahí está, ahí se debe hacer el esfuerzo y ayudar a hacer tareas a los muchachos, hablar con ellos, ser un buen amigo de ellos, que es difícil, sí es difícil, pero no imposible de lograr. Y ese equilibrio emocional yo pienso que es absolutamente trascendente en el éxito profesional. Si uno tiene un desequilibrio emocional, vive angustiado, vive con problemas, en fin, no van a ir las cosas bien. Y ahora, por supuesto, no hay que sobreponer la profesión a la familia. La familia está por encima de todas las circunstancias que uno quiera, pero implica sacrificios. Claro que sí.
Gracias, doctor Muñoz. Doctor Pedraza, doctor Weinstein, no sé si no veo al doctor López con su cámara prendida, pero quisiera escuchar si tienen algún comentario al respecto.
De acuerdo, doctora Sonia. Una de las partes más complejas es lograr ese equilibrio entre una familia y la profesión, porque son como dos amores que casi que no tienen, no tienen cómo cambiarse. Eh, como dice el doctor Muñoz, es a veces complicado. Cuando uno se compromete demasiado en la profesión, alguien paga un precio por el tiempo que le roba a la familia, pero, pero siendo, teniendo una conciencia estable, logra uno salir adelante profesionalmente y sacar adelante la familia. Y la saca adelante como decía Einstein, uno puede influir en la demás gente de dos maneras. Primera, con el ejemplo, y segunda, con el ejemplo. Personalmente, logré eh, ambas cosas en la vida y hoy en el retiro tengo una familia feliz con 4 hijos profesionales médicos, que 3 de los cuales ejercen en Alemania, 2 ortopedistas, una anestesióloga y una oftalmóloga en Bucaramanga. Pude lograrlo, pero no no es fácil cuando uno está transitando la vida profesional con todo el deseo de ser siempre el mejor profesional.
Gracias, doctor Pedraza. Doctor López.
Yo creo que eso lo dijo muy bien en sus comentarios el doctor Weinstein. Es el equilibrio entre lo que se hace en la profesión y lo que se hace en la familia. Está basado en los principios que uno tiene. Si uno quiere ser el más destacado, buscar siempre ser el más apreciado, no el más popular, como decía, uno pierde familia, pero si uno quiere ser respetado en su medio, uno gana familia, porque el respeto lo tiene en la familia y lo tiene en su práctica. Y básicamente yo creo que, como decía el doctor Muñoz y también Celso, el valor de la familia no lo supera nada y es lo número uno para. Y uno hace bien las cosas en el consultorio para ir a hacer bien las cosas en la casa. Y al contrario, hace las cosas bien en la casa para hacerlas bien en el consultorio. Uno no puede tener esas dos caras de tener una profesión ser famoso en la profesión, mientras en su casa no lo quieren ver ni en pintura. O al contrario, solamente ser un hombre de familia y no pretender hacer bien con sus pacientes. Pero yo creo que se basa, pienso yo, en el principio de valores que uno tiene por encima de cualquier cosa. Si uno tiene unos valores morales y éticos, no va a tener ningún problema en guardar ese equilibrio. Mire todos los cargos que ha desempeñado el doctor Weinstein y hace ejercicio todos los días, hace clubes de revistas, le da charlas a sus residentes y a sus estudiantes, participa en comités de los hospitales y tiene tiempo para ir a la casa a estar con su familia. Eso es no más que organizado y con sus valores, los valores. Eso no hay nada que hacer. Si uno tiene un valor ético, moral desde joven y eso no lo adquiere uno lo recibe en la casa.
Dr. Weinstein, can you tell us something about this question? Dr. Weinstein, can you hear me?
Me?
Yes.
Okay, well, I think that's the most difficult part of life is balance between your professional life, your personal life. And I think a lot of it depends on your partner. I mean, all of it depends on your partner. And I would say there's not a magic formula, and it changes every year because it's very difficult to have the life of a surgeon with hours which are irregular, taking trauma call. But I think, hopefully your spouse, and some of you may have a spouse who's also a doctor. So the balance is very difficult. So things that I did in my life is number one, I wanted to always take care of myself. So I would get up earlier so I could do my jogging very early in the morning because I always wanted to be home for dinner with my son when my son was in school. And then I would work when he went to bed. So I didn't want to deprive him of a father experience. And my wife has her own career, so we balance these quite well. I don't have a magic answer, but I would say every year is different because what's going on in your life is different. And I think in America, in the United States, the divorce rate, is quite high because people don't achieve balance in their life and they don't have the right partner. But it's something you have to work on every single day is this balance. And I don't have a magic formula, but again, for me, it was just starting my day early so I could take care of myself in the morning, make sure that I could try and get home for dinner when my son was at home, and then work after he went to bed, and be respectful of my wife's career so I could be her spouse as well, because she has a nice career as well. not a doctor. But I'm sorry, that's a tough one. I can't give a lecture on that.
Yes, but thank you for your comments. Marco, tenemos un par de preguntas
Sí, profe.
más.
Just another two questions. This one is for Dr. Weinstein. Dr. Ricardo Benavides asks if do you use any specific method to evaluate your results?
Yeah, so most of my surgery is either spinal deformity surgery in children or hip dysplasia. So I collect all of the standard patient-reported outcomes in the clinic. So all the patients fill out patient-recorded, if it's scoliosis, they fill out the appropriate forms. If it's hip dysplasia, the appropriate forms. And then they fill them out every clinic visit. We continue. And then I review them, every few years. So my spine cases, I reviewed, 4 or 5 times. My hip dysplasia every 5 or 10 years. I keep re-reviewing them by the standard of the day. And then we follow a protocol. So my hip dysplasia, I treat the same way. And then I reevaluate the results. And if the results are good, I keep doing the same protocol. If they're not good, then I see what's new in the literature and change my protocol. And when I was in Cartagena, I mentioned that. So Dr. Steinler, who started our department over 100 years ago, followed the same protocol for treatment based on the best evidence of the day. And then every few years, he would review his results. If the results were good, he continued the protocol. If they weren't good, he would see what's new in the evidence base for that disease, change the protocol, and follow again. And so he followed his patients his whole life. Dr. Ponsetti followed Dr. Steinler's patients. I followed Dr. Ponsetti's patients. And now I've been in practice long enough to follow my own. And over that 120 years, we have changed our protocol for hip dysplasia treatment in infants several times. But now I think after 120 years, I think we have a good protocol, which is yielding good results. We know what criteria we should use for when a reduction is not satisfactory closed. We know what's a satisfactory open reduction. We know by our data when to do an innominate osteotomy as opposed to using a cookbook approach. I'm sorry, it's a long answer, but I continuously collect data on the procedures which I do routinely, which is hip dysplasia and spinal deformity.
Thanks so much, Dr. Weinstein. And this one is just for our close. So, is there a question? Is excellence the goal of our practice, or maybe is the result of an organized and balanced work? You mentioned Dr. Ponsetti's, Dr.
Taylor.
Steinler. And what do you think about this question, and in keeping in mind that there were your partners or your peers in the work?
Well, I don't think I have never achieved excellence because my bar is always raising. So nothing is ever perfect for me. I can always run faster. I could ride my bike faster. I could have done my surgery today a little bit better, but I don't find that frustrating. I find it exhilarating. I want to do better tomorrow. I don't ever I'm never satisfied. Maybe that's not good. I know that I've helped the patient, for example, today. I know I did a good job, but I always think I could have done a little bit better. I could have been faster. I could have lost less blood. You know, everything could be, I'm never satisfied. And that's, you might find that a flaw, but I find it motivating for tomorrow. Tomorrow will be better than today. But I never achieve, perfection, but I'm always striving to get some semblance of excellence.
Bueno, maravillosa conversación. Muchas gracias a todos. Gracias al doctor Vargas por permitirnos organizar este webinar. Gracias, doctor Weinstein. Gracias, doctor Muñoz. Gracias, doctor Pedraza. Gracias,
Gracias.
doctor López. Fue un gusto escucharlos. Y bueno, espero que nos volvamos a encontrar pronto en este o en otros ambientes académicos, doctor Vargas.
Bueno, muchas gracias a todos por su participación, lo enriquecedora de la discusión y pues algo que debe permanecer en nuestra mente, la autoevaluación, el aprendizaje continuo y la enseñanza continua es el mejor modo de mantenernos activos y pues buscando la mejor calidad posible de atención a nuestros pacientes. Entonces, buenas noches para todos. Gracias, Sonia, por la organización de este excelente
Gracias.
webinar. Buenas noches.
Muchas
Muchas
gracias.
gracias.
Buenas noches.
Chao.
Buenas
Gracias.
Bye,
Buena
gracias.
noche. Muy amables.